And I am happy to report that after 35 years and 7 months of active duty service, that I am on day 97 with 12 hours and 23 minutes and 13 seconds of happy retirement life. And I love every second of it. But I'm going to talk to you from the subject entitled Leadership and Life Lessons Learned from COVID, Chaos, and Crisis. Leadership and Life Lessons Learned from COVID, Chaos, and Crisis. COVID-19. 1.2 million American citizens lost their lives to the COVID epidemic. Over 111 million American citizens contracted the COVID virus. Someone asked me the question, they said, well, General Dingle, what was the biggest lesson learned that you took as the Surgeon General leading through COVID? And I told them this, I said, my biggest lesson learned was in the halls of the Pentagon as we were preparing for our weekly COVID update to the press. The lawyers and the public affairs officers came in and were briefing myself and my bosses, and they told us this new bit of information. They said, you cannot say the number of deaths that are within the military. Do not say it. It's a red line as you go into this press conference. We go into the press conference and everything goes well. And as you may or may not know, when you go into a press conference, it's like going into a pool full of sharks. The blood is in the water. And here we are coming in to do the update. The update went for almost an hour, and we were closing out. It was the last 4 minutes left. It was another successful update, and now I'm sitting in the audience, and I'm like, whew, let's get this thing done. And then one reporter stood up, and the reporter said, well, can we get the Surgeon General back up to the podium because we have a question? And as I'm sitting there, I'm like, who in the world asked a question in 3 minutes left for the whole conference? But she asked the question, and the facilitator said, yes, General Dingle, come on back up to the podium. As I melted in my seat and peeled myself off to walk what felt like the Green Mile back to the podium, I get to the podium, and the reporter said, well, General Dingle, what is the number of deaths that are in the Army? And I'm thinking, well, we just did a whole hour and we did not give that number, but yet you're asking me again. And she said it again, and the cameras are rolling and the lights are on me. And I said, okay, well, you know what? I'm just going to defer the podium to my bosses. And so as I stood back and I looked over my right shoulder to my boss did the look away. I said, he did the look away on me. Oh, my goodness. Time seemed to stand still, and the cameras were rolling, and the lights were flashing, and sweat started coming off my brow, and I said, okay, well, I'm just going to go and give it to the boss, and I'm just going to leave. And so I took a half step back, and I looked to my boss, and we had a sidebar going on as the cameras were rolling, and I said, sir, you're going to tell the answer? You're going to tell the number? And my boss said, no, I'm going to tell the number, you tell the number. And I was like, sir, tell the number. He said, you tell the number, tell the number. I said, tell the number? He said, yeah, tell the number. So I stepped back to the podium and I said the number. My staff back in the office, they fell out. Oh, the General Dingle told the number. I walked back to my office in the Pentagon, and I go in and I shut the door behind me. By this time, my heart is in my boots because I'm thinking that, oh my goodness, I'm going to be on the evening news tonight. And as I sat down, my heart started to beat fast. And I realized that I also had not been eating. I hadn't been sleeping under the stress of what we were doing with COVID. And I got dizzy, and I said, I got to stop. I said, you know what? I got to practice what I preach, because I always tell all my leaders that if you don't take care of yourself, you can't take care of others. Leadership life lesson number 1. Take care of yourself so that you can take care of those you love and lead. Chaos. As the United States Army Surgeon General, I had the distinct opportunity to lead one of the largest mergers of a healthcare system in the history of our nation. the Army, the Navy, the Air Force, and the fourth agency were all directed to come together and merge our hospital systems in support of 96 million beneficiaries. It was pure chaos because the Army wanted to do it one way, the Navy wanted to do another, the Air Force the other, the agency wanted to do this way, and there were factions and there were foxholes and there were fighting. There was parochialism and we couldn't get along. The president established a presidential commission to review the military health system and talk to the surgeons generals. I went last because I was the largest, being the Army. The committee asked the interview questions and it was going well, and I thought I was hitting it out the park because every question I asked, they said, "That's right, General Dingle, we agree. We agree, General Dingle, that's right, that's right." And as the secretary was closing out the interview after 2 hours, the retired admiral said, "Well, Madam Secretary, is it okay if I ask General Dingle a question to make a statement?" And she said, "Go ahead, Admiral." The admiral turned to me and said, "Scotty, you said this, and this is what it meant." I said, "That's right, yes, ma'am." And then she said, "Well, Scotty, you said unity of effort, and this is the impact that it would have on soldiers." I said, "Ma'am, that's right." And she said, "Scotty, I heard what you said about this one, and I agree, and it means this." I said, "Ma'am, that's right." And I'm thinking like, man, I hit this one out the park. We're good, we're good. Then she said, "You know, Scotty, I said the same thing to my boss when I was an active duty 4-star. And you know what my boss said?" I said, "Ma'am, what did he say?" He said that if you can't ride 2 horses, it's time for you to go home. I said, "Yes, ma'am, I'm riding 2 horses." The lesson in life and leadership is that through chaos in your life, through challenges that come up, through problems, you can't get stuck on one way or no way. You have to be adaptable and flexible to the situations that come up in your lives, whether at home or on the job. Be adaptable and flexible. Crisis. The biggest crisis in my 35-year career in active duty was not from combat in Afghanistan. The biggest crisis in my career was not from combat in Afghanistan. The biggest crisis was not from getting shot at while in the air with aircraft. The biggest crisis in my career was the loss of my mom and dad. How many people got both parents living? Raise your hand. You are tremendously blessed. When's the last time you talked to mom or dad? When's the last time you've seen them, you've called them, or helped them through the medical challenge that they're going through? You joke around and say that they're getting old, and yes, they are. They need you. How many people got one parent living? Raise your hand. You are tremendously blessed. When is the last time you talked to mom or dad? Seen them, helped them. Time is unforgiving. How many people got no parents living? Raise your hand. You know what I'm talking about. You know what I'm going to say. Time is unforgiving. I was sitting in my office in the Pentagon one day, and I had not talked to my mom in 3 days. Something told me, go see mom. Go see mom. I left my office. My mom lived by herself in Maryland, and I drive there, and I ultimately get in the apartment, and I find my mom on the ground. She was conscious, and I was able to get her to the hospital in time. You know, we figured that it was somewhere between 48 and 72 hours that she fell and was incapacitated in her house alone. We get to the hospital, and the doctor says, "Well, Mr. Dingle, your mom has a UTI, urinary tract infection, an older woman. She was 72. They get loopy, and she may have fell and she hit her head. We're going to give her antibiotics. She's going to be home tomorrow." Saturday came, and my wife and I go to the hospital. Mr. Dingle, the white blood cell count didn't come down. We're going to have to do a CAT scan, an MRI. Mr. Dingle, the results are back. Your mom has stage 4 cancer. We got to do surgery right now. Mr. Dingle, your mom is on life support. You got to pull the plug. It was 23 days from the time I found my mother and she died. Time is unforgiving. Take care of mom and dad while they're here. At the same time, my dad was experiencing heart failure. He'd undergone quadruple bypass surgery. And now it was time for my family and I to go to a new duty station in Germany. And as we were going, my dad was like, "I'm not going to see you again." And I do like we all do. We always kind of brush off the reality of life and health with our loved ones and don't have that hard discussion. I said, Dad, you're going to be all right. You're going to be all right. I'm just going to Germany. Then going to come back. My dad was so proud of me. He's the only reason I was in the military because he retired and enlisted after 20 years in the Air Force, and he wanted his son to serve his country as an officer, and I came in the military. He was so proud that he would tell people, my son is going to be a general. I said, Dad, don't tell people that. I'm not going to be a general. No, Dad, I'm just going. We're going to command in Germany. We're going to come back and retire. It's not happening. We go to Germany. I take command, and within the first couple of months, I get picked up for 1-star general. I come back early, 10 months. My dad now has a defibrillator, a pacemaker, and a pump, pumping medication to a port in his heart, keeping his heart going. The proudest day of my life is my dad promoted me to 1-star general. He promoted me, then he died a couple months later. Leadership life lesson number 3. Time is unforgiving. Keep the important things in your life, mom, dad, loved ones, children. Keep them first and take advantage of the time you have with them now before they're gone. Those of us that don't have any parents left, we can only go off on memories. It seems like yesterday, but it may be longer. But you that have the loved ones still here, please remember that time is unforgiving. Spend it well. So as you navigate through the uncharted waters and try to find your footing in life, remember to take care of yourself so that you can take care of others. Remember to be adaptable and flexible in the situations that are thrown at you that seem chaotic in your lives and in your families and a job. And then number 3, remember, time is unforgiving. Spend it wisely so that as you navigate the uncharted waters of life, that you will live your life and life won't live you. Thank you very much.